Okay. Good afternoon, sir.
Good afternoon.
My name is Rachel Wiredu. I am an exam candidate of the Medical and Dental Council. I've been tasked to take some information from you. This will help me understand your problem and its management. I assure you of confidentiality. Please have your permission to go ahead.
Please go ahead.
Can we start by you telling me your name and age, please?
I am 46-year-old. My name is Kwabena Mensah.
Please, what work do you do?
I am a taxi driver.
Please, what brought you to the doctor today?
I've noticed that I am vomiting blood.
For how long?
For a day, please.
Is there blood coming from any other part of your body?
No, please.
Okay. Is there a way you can tell me how much blood you vomited?
The voltage bottle, the small one, it was almost full.
Okay. What was the color of the vomit?
Well, it was dark.
Okay. Please, have you done anything about it?
No, I just came to see you.
Okay. Can you kindly tell me if you've been diagnosed of any chronic condition?
Not that I know of.
Okay. Are you vomiting?
Yes, I'm vomiting blood.
Oh, okay, sorry. Have you lost any weight?
I wouldn't say.
Okay. Do you have do you have a history of using any pain medications?
Yeah, sometimes I use painkillers.
Okay. Do you easily get tired?
Yes.
Okay. Okay. When you're at rest, do you feel like your heart is beating fast?
Yes.
Okay. Have you noticed any swelling of your feet?
No.
Are you coughing?
No.
Do you have any difficulty breathing?
No.
Have you noticed a change in the number of times you urinate in a day?
It's about the same.
Do you have any abdominal pain?
No.
Have you been experiencing any diarrhea, constipation?
No.
Okay. Do you have any joint pain? Any swelling of your joints? Okay. Do you feel any numbness anywhere? Any visual changes?
No.
Okay. Have you ever been hospitalized before?
No.
Okay. Have you had any surgeries before?
No.
Okay. Is there any family history of cancers?
No.
Okay. Do you drink alcohol?
No.
Do you smoke cigarettes?
Occasionally.
How many sticks do you smoke in a day?
Oh, just 2 sticks.
Okay. Are you married?
Yes.
Do you go to church or you're Muslim?
I'm a Muslim.
Where do you live?
Official town, Odoko.
Do you have an active national health insurance?
Yes.
Yeah. Okay. Are you currently using any drugs, or do you have any known allergies?
No.
Okay. What painkiller do you take?
Diclofenac.
Okay. How long have you been using it?
Oh, since I started my taxi business, so maybe for the past 10 years or so. But it's not so like every day, but I've been using it for.
Okay. Thank you very much. Please, do you have any expectations?
Okay, so your time is up. Please present your case.
Okay. I present a history of 46-year-old Kwabena Mensah, who is a taxi driver. He was in his normal state of health until a day he presented with he noticed he was vomiting blood about a day ago. According to him, he vomited about half a liter of blood, was dark red. He has a history of NSAIDs use. On stomach inquiry, there was no systemic inquiry was unremarkable. There were signs of anemia, and he has no known chronic condition.
There were signs of anemia. What sign did you pick?
You said easy fatigability and palpitation.
Is that a sign?
No, symptoms.
All right. What is your diagnosis?
Upper GI bleed due to chronic duodenal ulcer.
Chronic duodenal ulcer. You see. What else could it be? What else could it be from?
Esophagitis.
What else could it be from?
Gastric cancer.
What else could it be from?
Mallory Weiss tear.
What else could it be from?
Chronic liver disease.
Will it cause such a dark? All right.
No.
What investigations would you do for him? How would you investigate this patient?
And I do an upper GI endoscopy.
Go ahead.
A full blood count, BU and creatinine, blood grouping, and cross matching with 2 units of blood.
How would you manage this patient?
I'll resuscitate. I'll resuscitate with normal saline, and also
Rachel,
I'll give blood.
Bro, how will you manage this patient?
This is a medical emergency, so I will counsel and admit. I'll I'll cancel and admit and I'll secure. No, sorry. There's a medical emergency, so I'll cancel and admit. I'll call for help, cancel and admit. Quickly do a quick primary survey and correct any notable abnormalities, such as starting supplementary oxygen if the SpO2 is less than 94. I'll gain IV access with 2 wide bore cannulas, and then use the opportunity to take samples for investigations. I will then resuscitate with normal saline and pass a catheter to monitor urine output. I'll give blood and
what else would you do for this man, apart from what you've said so far? You would give high dose proton pump inhibitors, wouldn't you?
Yes, please.
The indication for high dose proton pump inhibitor in a patient with peptic ulcer disease, one of them, in fact, the most common is a bleeding peptic ulcer. You would give a high dose proton pump inhibitor. So if it's omeprazole, like 80 milligrams BD, you can give over or via a continuous perfusion. What else can you do for him? Please hold on. Hold on. Rachel, apart from giving high dose proton pump inhibitors, what can you do for this man? Why were you doing the upper GI endoscopy?
To diagnose.
Is it only for diagnostic purposes?
No, it can be for therapeutic purposes.
What therapeutic measures can be used to manage this patient's upper GI bleeding, or his supposed bleeding peptic ulcer?
We can inject adrenaline.
You're not sure. So injection therapy would dilute adrenaline. That's number one. What else?
A heater probe can be used.
So thermal coagulation, isn't it?
Yes, please.
Using a heated contact probes. What else?
Clips can be applied to stop the bleeding.
Excellent. Endoscopic clips. Any others?
No.
Okay. Well done. Last question. What score would you use to assess if this patient needs an intervention or not?
Recording in progress.
Racheal score?
Don't. It's not Racheal's. What score? This patient has come to you, you've given your PPI, your high dose PPI. You think that it is actually you went to do endoscopy, stabilize the patient, went to do endoscopy, you've given your PPIs. What score would you use to assess his need for an intervention? It is not Racheal, it is Blatchford. Assessing the need for intervention is what?
Blatchford.
Okay. The Racheal score is done pre-endoscopy and post-endoscopy for variceal bleeding, and it's mostly used to assess the mortality, the patient's risk of rebleeding. But whether variceal or non-variceal, whether to do an intervention or not, the Blatchford score what is used to assess the patient's need for an intervention. For example, GI bleed. Is that okay?
Yes, please.
Well done.